Hey guys, welcome to another episode of Amber Unfiltered. Today I'm back with part two of my What is Really Going On With Me video. I just finished my I-9 appointment, like basically to identify myself for my new job. So that went well. I was a little peeved off because, bitch, why were you like 15 minutes late? They were like, oh, we had a meeting that went over. I'm like, I'm just sitting on here looking at myself. Like, I don't want to stare at my own reflection. If I want to do that, I'm gonna go and look in the mirror, bitch. What is that song from Mulan? Show. Bitch, that was me. I was like, okay. And then it was just awkward because this woman is just like looking at me, I'm looking at her, and I'm like, I can't really hear you because your coworker is over talking you, talking to someone else on the same thing. I was like, it's not giving. Y'all don't have a private room or office? Like, I can't. But anyways, I'm back with my part two. What is really going on with me, my endo journey, my PCOS journey, my like health journey overall. Remember, don't forget to like, comment, and subscribe. Also, if you want to cash at me at Amber Unfiltered Show, that'd be greatly appreciated. Also, I'm going to open my email to anyone who's battling endometriosis, who's battling anything, or thinks that they suspect that they might even have it. I think the email is amberunfilteredshow@gmail.com. Keep it cute because I will mute you if you're not. But anyway, I feel like y'all have some sense. My subscribers really do be coming through with the clutch, so I'm not gonna shit on y'all too hard. But anyway, so I wanted to finish my video. This is probably gonna be long as hell too, and again, it may get graphic, it may get emotional. I was actually shocked that I didn't cry more in the first video. Not that I wish myself to cry, because I've done enough crying to fill up a fucking bathtub, but you get my point. So anyway, so where was I think I left off with the first OB and the issue I had with them gaslighting me and acting like I didn't have something far worse or far more chronic going on. So by the end of that appointment, like I said, I just felt very off. I didn't like how she handled it. I didn't like how I felt. I was like, my gut doesn't feel right. I don't feel right. And I was like, this issue is going to keep persisting until I actually nip it in the bud and like step up and do something about it and be consistent about it. So like I said, a few days went by. I looked up endometriosis specialists near me and made an appointment. And then it was just kind of like the waiting game from there. I still had my biopsy on the books. And then after that, I think a few more days passed and I was like, I still don't feel right about meeting with that doctor again because I was supposed to have a follow-up appointment with her as well as the biopsy. So I actually called back to the OB, and this is where I was really proud of myself too, and for stepping up and doing something that felt authentic to me, but also safe for me. Because I tend to be very anxious when I go to the doctors. I always feel like they're not going to really see me, especially not as a whole person, as a whole individual. And I feel like a lot of the times they're not going to believe me. So I was kind of pleasantly surprised with this part. But I called the office back and I was like, hey, can I move all of my appointments to a different provider? I was like, I felt very dismissed by the provider I met with. She gaslit me and I need to see someone else. And they were like, absolutely no problem. So they moved me to a different doctor to do my biopsy, except it wasn't going to be able to be done until January. And then I had like a follow-up after that, like a week or so later. And I was like, that's fine. I can wait a little bit. I've been waiting 4 years, was another 2 fucking months. Doctor's offices be filling up mad quick. I'd be like, oh my God. And I used to work in one, so I should know. But I was just like, damn. But I feel like it's certain times of the year where like they really peak. So I was like, okay. So I had my appointment on December 8th. And in between this, I still would have little flare-ups and have episodes, but it seemed to have calmed down a little bit. But there would be some days where it would be really heavy bleeding, or I would like clot. I actually don't really remember clotting that much. I think it was just the random, it looked like spotting, but like maybe a little bit heavier than spotting, if y'all know what that is. Spotting is like very light blood, like almost as if you're on, it usually comes when you're on your period or getting ready to have it or getting ready to end your cycle. So I had my appointment on December 8th. I was really fucking nervous. I did a lot of prayer. I did a lot of meditation because I was like, what if I have the same experience as before? I didn't think I would, but I just was very anxious because of the incident that I just went through with the OB that I had already established and had been going to for a little bit. So I was like, okay, just breathe. And I just prayed and I was like, I hope. Oh, also, I meant to tell you, there was so much information. So sometimes I tend to mix stuff up or forget things. What I started doing after each appointment in the beginning, I would take a voice note and just document what was going on. Cause I was like, I know there's no way I'm going to fucking remember this. And that actually really helped me, and it just helped me get it out and helped me get those feelings out. And I was also journaling a lot. I do want to say, if you're going through something, any chronic illness, whether it's this, whether it's something similar or completely on the opposite end of the spectrum, please take care of your mental health. Journal, go for walks, do self-care, go to the spa, get your nails done, whatever it is you want to do. It doesn't have to be, the typical thing. Whatever self-care looks like to you, practice it and be consistent with it, because taking care of you is also important, because managing a chronic illness is a job in and of itself. So what was I about to say? What was I gonna say? So when I saw the OBGYN on September 25th, I think that was the first one that I thought was so great. And then she kind of like she kind of turned on me a little bit, I felt like. So she had told me that there's two ways to treat endometriosis. From what I can remember, was one, the metformin, basically medication regulating it and it helping attack the symptoms, especially the main symptom, which was the insulin resistance. Obviously diet and diet and lifestyle changes, like working out, eating better and stuff like that. But the main thing was that. Or she said I could get a laparoscopic surgery, which I'm going to touch on really quick. Hold on. All right, because I want to make sure I say this correctly. So basically, they can go in, and I believe, to my understanding, I thought you can either cut it out or burn it out. So we're going to touch on that for a moment because this does come back later in the story. So I said, what is laparoscopic surgery for endometriosis? Laparoscopic surgery for endometriosis is a minimally invasive procedure using small abdominal incisions, basically cutting, a camera, which is a laparoscope, and tools to diagnose, map, and remove endometrial tissue and scar tissue, offering precise treatment with faster recovery than open surgery. Surgeons inflate the abdomen with gas for better visibility, then excise, which means to cut, or ablate, burn visible lesions, providing a definitive diagnosis and treatment for pain or infertility, often allowing patients to go home the same day. So this is really taking away the medicine. I don't want to minimize that because I've seen a lot of people say that they have taken it and it's worked wonders for them, but I couldn't get past the diarrhea, and they said that that would happen for about a month. And I was like, there's no fucking way I'm going to be shitting at 2 a.m. every morning. Like, I was like, that's a non-negotiable for me. I know Lori Harvey said it worked for her. There are other celebrities and other everyday women that said that they've used it and it's worked for them. But again, I told you guys I'm very sensitive to that stuff. I think it like upsets something in the GI tract, and that just causes all these issues. And I was like, I'm not willing to put up with that. Like, I can put up with a lot of things, bitch. I've been bleeding and clotting for like 4 or 5 years. If I can deal with that, I was like, I literally cannot do diarrhea. Like, diarrhea is so painful and it's so unexpected. I was like, my sleep should not be interrupted because my bowels want to do what they want. They want to have a party and they want to have an after party. Like, it's giving no. So she had told me about this, that this was an option, and I had kind of put it at the back of my mind because I was like, that's probably going to be something I revisit at that time back in September of last year. So how it works: number one, anesthesia and incisions. You're under general anesthesia and the surgeon makes 2 to 3 tiny cuts in your lower abdomen. Number two, inflation. Carbon dioxide gas inflates the abdomen to lift the abdominal wall, creating space to work. I actually didn't know this. I don't know why. I feel like I looked this up, but I feel like I don't remember this because I probably looked it up so long ago. 3, visualization. A laparoscope, a thin tube with a camera, is inserted through an incision, projecting images onto a screen. Number 4, treatment. Other small instruments are passed through the other incisions to excise or cut out or ablate, destroy with heat or laser, endometriosis implants and adhesions, scar tissue. 5, closure. The gas is released and incisions are closed with dissolvable stitches. And there was something else I was about to say. This is like the best way that they can really give you a full diagnosis. So I guess I'm unofficially diagnosed, but pretty much all of my providers believe that this is what I have. And something else my physical therapist just told me is that there's different grades of endometriosis. There's like 4 stages of it. I had no fucking idea. I thought it was just one and done, but evidently fucking not. So it says grade 1 is minimal endometriosis, grade 2 is mild endometriosis, grade 3 is moderate endometriosis, and grade 4 is severe endometriosis. I feel like I have, and I don't want to like self-diagnose, but kind of based on how I am, and it's like a point system too. I wanted to add that. I feel like I have like deep endometriosis. I think the acronym is so fucked up. And again, I'm self-diagnosing. Don't take too much stock into it, but there's something called DIE or DE, which is deep endometriosis. It says it's a severe form where uterine-like tissue grows deep over 5 millimeters into pelvic organs like the bowel, bladder, uterosacral ligaments, or vaginal wall, causing significant chronic pelvic pain, painful periods, painful sex, dyspareunia, I might have said that wrong, and bowel or urinary issues, often requiring specialized surgical treatment. It's considered the most aggressive type, impacting quality of life and fertility. And I think, well, I'll touch on that later because I haven't gotten to that part. Yeah, it says what it is: deep infiltration. Unlike superficial endometriosis, DE tissue invades deeply beneath the peritoneum, which is the lining of the pelvic cavity. Again, I'm not a doctor, I'm just reading what I see here. Common locations: most often affects the rectovaginal septum, uterosacral ligaments. And my physical therapist always talk about the uterosacral area. I forget what that means. Yeah, I'm gonna look this up because I actually don't know. They be talking, I'd be like, what? So it says the uterosacral ligaments are strong, fibrous bands of connective tissue that run from the cervix, base of the uterus down to the sacrum or the lower spine. Yeah, actually, so something else, I know I'm all over the place, I'm sorry. So something else that they've introduced to me in physical therapy is dry needling to help treat the back pain, because it can be, I'm telling you, that shit is excruciating. Okay, hold on. I'm about to find it for y'all. I'm sorry, I'm going all over the place. That's what I'm saying. This thing is so, it's like a spider web. It just shoots out and has so many branches and webs. And it's just like insane. So it says dry needling in physical therapy is a treatment where a therapist inserts thin, solid needles into tight muscle knots or myofascial trigger points to relieve pain, improve movement, and speed healing, working by stimulating a healing response, increasing blood flow, and reducing muscle tension, often combined with exercise. It's a drug-free technique targeting musculoskeletal issues like neck pain, headaches, tennis elbow, and sciatica, distinct from acupuncture, but using similar needles. How it works: targets trigger points. Needles are placed into irritable knots in muscles that can cause referred pain. And I've actually done this a couple of times. I think I've done this like 2 or 3 times, and that shit hurts. I'm not gonna lie, like it hurts, but you can feel the difference because the muscles definitely do loosen, because it's like a tightness, and it's basically trying to like loosen up the pain and the inflammation. So elicits twitch response. The needle can cause a spinal reflex twitch that helps release the muscle, simulates healing. It creates a micro injury that signals the body to send healing cells to the area, promoting natural repair, increases blood flow, releasing the trigger point, improves circulation, reducing tightness and pain. So what to expect: a brief prick when the needle enters the skin, followed by muscle twitching or soreness. I've noticed the difference on days when like the endo is very calm, it's not as damaging, but when it's like flaring up or my uterus is pissed with me is what I basically say, or when she's sitting sipping tea with her pinky up, because that's what she was doing today. I just basically call her a she. I just like have I haven't named her yet, but I kind of try to make myself laugh because I'm like, what else can I do? I try to I almost like personified her in a way. But there's been days when it's been really bad, and like as soon as the needle goes in, it's like very tight, it's very hard, but it's very painful. It's almost like sometimes they can't even get the needle in because there's so much resistance because of how much pain and inflammation it is on that particular part of my body. It says also you can expect soreness, fatigue, or bruising can occur for 24 to 48 hours after treatment. I haven't seen that, but again, I can't see my fucking back. It says relief from pain and improved motion can be felt immediately or last for weeks, especially when followed by exercises. Yeah, so it says key takeaway: dry needling is a complementary therapy, not a standalone cure, used by trained physical therapists as part of a broader plan to address the root causes of pain and movement dysfunction. So yeah, so anyway, let me go back because I know I just kind of went all over the place. So yeah, pretty much all the symptoms I have kind of align with the deep endometriosis, which is why I think I have that. Because I told you guys earlier, like it feels like these deep grooves and deep pockets of pain, and like pebbles or rocks or like stones, like it's so hard, like they're rock hard, like it's insane to even try to describe it. Okay, hold on. Oh, I didn't know this. So it says why it's serious. It can significantly disrupt anatomy and organ function. It's a major cause of infertility. Specialized expertise is crucial for effective management. So let me go back to the grades of endometriosis because I'm all over the place. Again, there's like so much information, but like also not at the same time. Like I think more research needs to be done on like specific populations it affects. How does it manifest? Why does it keep showing up as much? Why doctors tend to overlook or misdiagnose or don't have the skill set to address and diagnose and to treat, because I think that's a larger conversation that needs to be had. So yeah, so stage 1 is 1 to 5 points, stage 2 is 6 to 15 points, stage 3 is 16 to 40 points, and stage 4, I believe, is more than 40 points. But it says this staging doesn't always match pain levels, as severe pain can occur in early stages. Stage 1 involves few Stage 1 involves few superficial spots, while stage 4 includes deep implants, large ovarian cysts or endometriomas, and dense adhesions, potentially distorting pelvic anatomy. Oh, interesting. Oh, Lord. So I guess I kind of touched on it, but I'll just go over it really quickly. The 4 stages of endometriosis, ASRM system. Stage 1, which is minimal, 1 to 5 points. Few small superficial implants and or mild adhesions. Stage 2, mild, 6 to 15 points. More numerous, deeper implants, possibly with small ovarian cysts and filmy adhesions. Stage 3, moderate, 16 to 40 points. Many deep implants, significant endometriomas, or chocolate cysts. And I looked these up the other day. These shits are insane. I'm not going to gross you out too bad. You can look it up on your own. Literally the word chocolate, like a bar of chocolate, and cysts, CYSTS, on one or both ovaries and dense adhesions. Stage 4, severe, which is over 40 points, extensive disease, large ovarian cysts, deep implants on other organs like bowels or fallopian tubes, and thick, dense adhesions that combine organs together. Like, it's insane, like how debilitating and how much this disease ravages the body. I can't begin. It almost reminds me of like a vulture feasting on a carcass. Like, it digs and it goes in there. Like, I can't explain it. Okay, so let's go back to, so yeah, basically the surgery is like really, I think the medicine can help, but really the surgery is like the key way, because they can actually open it, the body, open the womb or the uterus or whatever up and actually see it. Like, like I don't know why it didn't show up on the ultrasound. I don't know why it doesn't show up on the ultrasound. That's kind of odd to me. I'm like, someone can't develop something. I'm like, we have all this technology. You mean to tell me someone can develop imaging or a procedure to kind of help attack it head on? Like, we have ultrasounds for everything else. Why don't we have an ultrasound or some type of blood test or something for this? I think they do in other countries, but I don't think there's anything that's like universally used. And I think it affects more than 1 in 10 women. I'm not a doctor or anything. I think the numbers are much higher than what we know. Okay. So look, or not look, I'm sorry. So we're going to talk about key benefits and uses. Definitive diagnosis is the only way to confirm endometriosis with certainty through direct viewing and biopsy. Treatment removes visible lesions and scar tissues, which can relieve pain and improve fertility. Minimally invasive, smaller incisions mean less pain, less scarring, and quicker recovery than open surgery, which is a laparotomy, and address various cases. Effective for mild to severe endometriosis, endometriomas, or ovarian cysts, in complex cases involving organs like the bladder or bowel. What to expect post-surgery. Recovery often allows for same-day discharge. Expect some grogginess, soreness, and gas pain from the inflated abdomen. Pain medication, restricted activity, driving, sex, heavy lifting, and follow-up care are standard. So, yeah. So that's kind of, I don't know. So I don't, where am I trying to go from this? So I'm gonna explain like how my appointment went with the second doctor and then get into like my treatment and everything like that. So I told you guys I saw this new doctor on December 8th, and it was actually a male doctor, and he was a male doctor of color, which was cool. I also had my husband come to me with that appointment, and we were so fat. So when we were driving over there, okay, there's a whole backstory, but I'm not going to give you the whole backstory. So we knew that there was a pie shop near the doctor's office, but it was like the complete opposite direction. So bitch, we ended up being late for the appointment because we wanted to get this pie, okay? We had been talking about this pie for like a good week or two, and I had an opportunity to get it, but I got over there when the pie shop closed. But that was so ghetto. But anyway, so we got our pie. We got a pecan pie from this bomb ass, like old fashioned apple pie, like pie store. Like, it gave like grandma's recipe. Like, that pie was so good. I was like, this pie is better than anything you can find in any store. Like, I promise you. It was so fucking good. So we got the pie. We headed over to my appointment. First of all, I was really impressed because the office was really beautifully decorated. You could tell they had some money. There was another doctor's office across the hall, but I think they were owned, like they were like interchangeable practices or owned by the same people or group. And so I sat down. I thought it was really cool because when we got in there, they had like this kiosk where you put your insurance card, your ID, and I want to say your debit card. It might have just been your ID and your insurance card, and you could check yourself in. You didn't even have to go to the front, which was really nice. And so I think I had to fill out a little bit of paperwork, which was crazy because I was like, bro, I already filled this out online. Don't you hate when they give you paperwork, they email it to you ahead of time, then you still got to fill shit out? And it's like, but bitch, why did I fill it out ahead of time if you're going to just make me repeat stuff? Or it's like you repeat the same stuff you told them over the phone, like your demographics, and you're like, okay, bitch. But anyway, hold on one second. I know they probably need it for your chart and to create some sort of paper trail or digital footprint. So we went into the exam room. I talked to the nurse. She took my vitals. I think I explained a little bit about why I was there. And then she was like, the doctor would like to see you in his office. And we talked, and I started giving him this whole backstory. And he was like, so what's the main complaint? And I was like, oh, now you're trying to get right to it. But I was like, maybe I gave a long ass explanation. Maybe I was trying to lead up to that. And so I explained to him, and just like the previous OB, the one that I actually really liked, that diagnosed me, like unofficially diagnosed me on the 25th of September, he was like, starting to ask me those probing questions, but it was like his approach. Like, I hate to say this, I've worked in doctor's offices before and then have also been a patient as well. I feel like a lot of doctors have huge egos. They're unapproachable. They're not down to earth. But he was just like very calm, very like, okay, so what can we do? Let's get to the root. Let's attack it. Let's address it. Let's come up with a plan. Let's see how we can get you to working order. Let's see how we can get you back to functioning, basically. And he was like, he shook both of our hands, like me and my husband's hands. And then we talked it through, like my symptoms and everything. And he was like, asking me about my period. Like, again, those in-depth questions, trying to get a good gauge of like potentially how long this has been going on. And also too, I think I've had endometriosis longer than I probably have known. I like actually, when I first went to that first appointment on September 25th, I was like, I wonder if I've had this my whole life and just didn't know. Like, or about the time I got my cycle, maybe like when I was in middle school or high school, I was like, what if I have and I just didn't know? Like, I was just thinking about all the pain that I experienced. Like, sometimes I'd be on the floor, like in the fetal, on the floor, clutching my stomach. Like, the pain was so bad, but I was just told, oh, it's just a part of being a woman. Oh, just get birth control. Oh, just regulate your cycle. And I'm like, no, like, this is not okay. But anyway, so I kind of like went down memory lane and just started thinking about different things. But when I can actively remember is probably about 2020, 2021. So, okay. So, he took us out of his office and then we went back into the exam room. He was like, hey, can you stand up? Because Nick was sitting in the chair. You know how they have like the extra chair for like if you have someone there or if you want to sit there. And so he was like, hey, can you stand up? Because I went to try to sit on the exam table. And the way that he like led the appointment or like facilitated it, I really, really loved. He just made it like so understanding for both of us, because I feel like when I took him with me to the other OB, the one that dismissed me and thought I only had PCOS, she was talking like that medical jargon. And I'm like, if only, like, I don't want to say if only you're a woman, you would understand, but most women understand women issues. That would be like me going to an appointment for his reproductive organs or system. Like, I wouldn't probably understand what was going on because I don't know that anatomy like that. And I just felt like Nick was like a fly on the wall. And I was like, I kind of had wished she incorporated him more. I didn't even know that a doctor could do that, like could manage an appointment like that and lead an appointment like that. But he was like, hey, can you just stand up? And it was like we were equal. Like, we were both standing at eye level, just talking. He would consistently ask, but not in a condescending way. That's what I want to say. A lot of doctors are condescending and very like high up, have huge egos, but to me, he didn't come across that way. He totally could be, for all I know, but he wasn't like that with me. So I remember, what was I gonna say? So he's looking me in the eye and he pulls the exam paper down and he starts doing a drawing on there. He breaks down why my body is doing what it's doing. And some of it I kind of already knew, but I just let him talk. But he made sure to include Nick in the conversation. He didn't use a whole bunch of medical jargon. And if he did, he like pared it down so that everyone in the room could understand. And he would constantly ask me like, do you understand? Does this make sense? And he would give me like a second or two to process it. And it just made sense, like how he explained it. He's like, this is why it's doing what it's doing. Here's what we can do for plans of action. So when I told him everything, he was like, okay. And we talked through like he was literally drawing a diagram on the exam paper. Like, I actually have a picture of it on my phone. I just really liked how he took charge in that appointment and included my husband. I was so grateful because I was like, this must be confusing for my husband. Like, I felt like he was kind of bored at the first appointment because he didn't know what the fuck was going on. And I was like, I can't really blame him. I was a little sad and I was like, I kind of want to go to my next appointment alone, but I know I need to lean on you. It's hard for me to lean on people and to trust them and to let them hold space for me. I'm very It's hard. It's easy for me to do it for other people, but I don't trust other people to do it the way that I want, which is probably a toxic trait. But anyway, so after that, he's like, hey, do you mind if I do an exam? And I said, yeah, absolutely. And he's like, take, your bottoms off, cover it, and then I'll come back in the room in a couple minutes and I'll have my nurse assist me. And so he went in. I'm telling you, as soon as he barely got in there, like, pain, it just like, not even burning, it's like I know burning and searing, but it was like a searing pain. Like, it felt like a wildfire had swept through my fucking vagina. Like, it was insane. You know what I feel like right now? I feel like, I don't know if you guys have seen that movie Die My Love with Jennifer Lawrence. There's a couple of scenes of her in the woods. The ending scene keeps replaying over and over in my mind, because I was like, I literally feel like that right now. Like, a woman on fire, a woman would just fucking rage. Like, oh my God, it was just, I again wanted to cry. I just like started making noises, and he could tell. And he would, even before, this is what I really appreciated and liked. He treated me with such empathy, such care, like genuine care, genuine concern for my well-being. He was like, if anything hurts, please let me know. He was like, I'm going to try not to. And he was like, we can stop. Like, he just gave me control and like input. And I really like that. And his nurse was there. And I was like wincing, like I started to tear up because that's how bad it was. Again, I can take a lot of shit. And I know that there's like a misconception that Black women can't experience pain or suffering. Bitch, we can. And this is one of the most painful things. I think this is the most painful thing I've ever dealt with in my life. I've gone through some very traumatic shit, but this is probably the most traumatic in recent memory. And like, probably the last 10 or 15 years, probably 20 years. Like, honestly, I'm only 31 going on 32, but girl, I was like, I can't. And it just felt like, I don't know how to explain it, just raw, like flesh, like almost like if you have an open wound and like air hits it and it just like starts hurting, you know what I'm saying? Like, but it felt very fleshy, like fleshy, painful, raw, sore, tender. Like, I'm telling you, he didn't go that far. And the deeper he went, the more it hurt. Like, it was just a lot. And he didn't really, I don't even think he was really in there like that. And like certain angles and stuff, it started hurting more. Like, I told you, sometimes on the right side, it's really, really painful, but then it will roll over to the other side. And something else, like randomly that has been happening, I've been having like little phantom pains, like in my pelvis, like just like the bone area. Like, it'll just start like thudding or like being like a dull ache. Like, and I had to call him, I think his office, like a couple days ago to try to see if someone can help me, but no one could. So I emailed someone on their team, and they referred me to the nurse, and he prescribed me something because it's just been random. Like, and I'm like, what is that about? But I looked it up, and apparently it's normal. There's so many just like little things, but they can really impact your day, and they can really interfere with your mood. Cause I noticed like I've been like, my mood is just like a roller coaster, and it goes up, down, and it's just all over the place. And I was planning to do a separate video on that as well. That will kind of go with this. But, what was I gonna say? So he did that, and then we wrapped up, he cleaned up everything, and he was like, based on like what you were telling me, based on like the exam and just like how you responded and everything, he was like, I'm pretty sure you have endometriosis, but he was like, realistically, the only way is probably the surgery. He was like, we have one or two options. We can manage it with medication, or we can manage it with surgery. And he was like, you don't have to tell me right now, you can think about it. I said, yeah, I'm ready to get the surgery. Like, what do I sign? Do I have to get my firstborn to get this surgery? Because I will do it. Like, even before I had gotten to that appointment, I was like already thinking about it and like really taking time to pray over it. And I was like, I think I want to get surgery, because I was like, I literally cannot manage this on my own. And I was like, I don't think the medicine is working. I know historically I just don't do well with medicine. I tend to be more holistic, like natural things, and just like gummies and supplements in that way. But like actual pills and stuff like that, it just tears me up. I don't know what it is. I just always have a very adverse reaction. I remember years ago, I was, I had forgot about this because it's kind of been dormant, but I was diagnosed with Lyme's disease back in like 2012, maybe 2013, maybe 2011, somewhere in there, like between 2011, 2013. And I had to take this medicine, and that medicine literally made me dizzy. It made me so fucking dizzy, I almost passed out. I remember I was working at Burger King. It was my first job, and I used to take the bus. My mom was like, if you take the bus, I'll come pick you up after work. And I was like, all right, cool. So she's like, just find your way there, and I got you later. And I remember I was standing at the bus, and it was hot as fuck outside, and my head I started like spin. I like almost passed out. Like, it was so bad. And they said that I had vertigo or syncope, which is like fainting spells, dizziness, and things like that, like loss of balance. Like, I was like, oh my God, like I always have horrible reactions. Like, TMI, this is so bad. I told my coworkers this recently. I think I told you I was sick recently and I didn't record for a little bit because I was coughing so much and I like lost my voice. I had to like communicate with hand signals and like my phone, like typing notes and stuff on my phone or typing text messages. And I remember I took the antibiotic for that. Bro, I started hallucinating. Literally started, and I'm like saying I'm sober, I haven't drank, I don't do drugs, like nothing. Was just talking water. Like that's it. Literally, I thought my arm fucking had melted off because like one, I was sleep deprived. I hadn't slept in like 3 days because the coughing was so bad I couldn't sleep. And I tried sleeping sitting up. It didn't matter what I did. I tried sleeping in different rooms, sleeping in different angles. Bitch, it didn't work. But this medicine, I literally like, it felt like my arm had melted off, like almost like a Salvador Dali painting. Like it was so bad. I'm telling you, medicine and me, we don't mix. So anyway, so yeah, he was like, based on what you're telling me. And I was like, I want, or let me not say based on what you're telling me, but I was like, yeah, I want the surgery. I was like, where do I sign? He was like, are you sure? I was like, yes. I was like, I can't do this. I was like, this is taking over my life. Like, I'm always tired. I'm always worried about having an accident. I do have accidents. I don't have any energy. I'm tired of body shaming myself. I'm tired of hating my body. Like it affects so many different, and then like I noticed too, like I don't want to say what part of my body, but sometimes I get like skin tags. I have like all these weird little quirks that I just thought, oh, it's just aging. It's this. It's the fucking endo. It's the fucking PCOS, and I had no fucking clue. I was just like, I'm a shot in the dark right now. Like I was just like, I'm ready. Like I'm tired. Like I'm tired of being tired. I'm past the point of fucking tired. I'm literally at my fucking wits end. Like I was like, I can't even enjoy my life because this thing takes over. I'll be like in class, I'll be bleeding. I'll be walking to class, I'll be bleeding. I'll be at a family function, be bleeding, be worried out of my mind. I can't even like really be present and enjoy it because I'm just so focused and fixated, especially when I'm having one of those flare-ups or episodes. Like sometimes literally I've had a couple of flare-ups in my last couple of sessions. I can feel it coming. Can you imagine feeling a blood clot passing through your vagina? Can you imagine that coming through your butt or your other genitalia? Like, can you just imagine? Like, and it's huge and thick, and then you just start bleeding, like, but it feels like rain. It feels like a flood. Like, and then just your body just shuts down. Like, I feel like a computer that's like, like, like just winding down, like, or malfunctioning, like literally. Like, and it makes me feel weird too, because I'm like, I'm a woman. I know my only, not my only duty is to reproduce or procreate, but I was like, I'm a woman and my ability to conceive is impacted. That also makes me feel some type of way because I'm like, this is one of the main things that I'm here to do. I know it's not the only thing, but I really want to be a mom. So I'm like scared to fucking death. I'm like, if I have a miscarriage, I'm gonna be fucking gutted. I'm gonna be so real with you. And I was like, that's a possibility. I have to really be real with myself. I could lose the baby. They say that people with endometriosis can get pregnant. It's the pregnancy sticking and staying. That's the hardest part. And I'm like, that's terrifying to me. I'm not gonna be able to deal with that loss. Like, I'll do what I gotta do, but I was like, I really can't stomach that. And I just have to like mentally prepare myself. And it's just like a lot. So, and my doctor also told me, he was like, doing pelvic floor therapy is really going to help you. So basically there's muscles in your pelvic floor that work. I'm trying to think how to explain it. Hold on. I want to explain it correctly. Okay, hold on. Okay, so okay, yes. So I said, what do the muscles in your pelvic floor do? Pelvic floor muscles act as a supportive sling for your bladder, bowel, and reproductive organs, controlling urination, defecation, and sexual function while stabilizing your core and pelvis. They work with your diaphragm and deep core muscles to manage pressure from activities like coughing or lifting, preventing leakage or incontinence, and supporting organ position. Support. They form a hammock-like base holding pelvic organs, bladder, bowel, uterus in females in place, preventing prolapse. Continence. They control the sphincters of the urethra and anus, allowing you to hold in urine, feces, and gas until you choose to release them. Core stability. Working with your diaphragm and deep abdominal muscles, they stabilize your spine and pelvis during movement. Sexual function. They play a vital role in arousal, orgasm, and ejaculation in males. Sump pump action. They help pump blood and lymphatic fluid, reducing pelvic inflammation. When they're weak, they cause incontinence or urine or fecal leakage, pelvic organ prolapse, organs dropping from their normal position, or sexual dysfunction, issues with arousal or climax. Strengthening these muscles through exercises like Kegels helps maintain bladder, bowel control, improves sexual health, and supports recovery from childbirth or prostate surgery. What is it called? Hold on. because I want to explain this to you guys. Okay. Hold on, guys. Because I wanted to touch on this real quick. Okay, I don't think that's the right thing, but basically, so anyway, let me go back to the appointment. So I told him I wanted surgery. He was like, okay, I'll put a referral in, and he was like, I want you to see an endocrinologist to get the hormones under control. And I said, okay, or the hormonal imbalance, I should say. Hold on. So he was like, I'll put the order in, and someone from my surgical scheduling team will call you. And I was like, okay. So that gave me some hope. So then like a whole week or so went by and I was like, oh my God, no one's reached out. And so I reached out and they were like, well, we'll get back to you, because I tried to call, but she didn't pick up. And I was like, she's probably really slammed. And he told me that there would be like a pre-op appointment. Basically, pre-op is basically before your surgery, what you need to do, what you need to know. And he was like, that will be virtual, and then we'll go from there. And I said, okay. And he told me where he will perform the surgery and everything like that. And so then I heard back from the surgical scheduler and I booked a date. It is January 30th. I'm fucking terrified out of my mind. I'm very, very fucking nervous. But I feel like I'm out of options. I was like, I can't manage this on my own. I need something else. I need some extra support. And I want my life back. I want my peace of mind back. I want my sex life back. I want how I view myself back. I want to be healthy. I want to not feel so much pain, so much inflammation, and so much uncertainty. Like, it feels so crazy to feel like this within your own body. Like, I cannot begin to describe how like grief inducing it is, but also how isolating, because unless you're going through it, you really don't understand. And I love my family down, I love my friends down, I love my husband down, but I sometimes feel like no one understands me, and I sometimes feel misunderstood, because it's like they're like, oh, we're proud of you, you're doing something about it, but it's like, yeah, but I still have days where I feel like shit, where I'm not myself, where I'm drained. I'm doing pelvic floor therapy twice a week for 8 weeks. I've been going since November. That shit is hell. Physical therapy is pure torture in general, but I was like, this is so crazy. I'm using muscles I never thought I'd use before, body parts I never thought I'd use before, pushing myself to the limit. Like, I feel like I'm a fucking Spartan gladiator or some shit, like a extra in fucking 300 or a soldier in 300. Like, I cannot believe there's been times I've broken down in my sessions. I've cried like in front of my physical therapist, because it's a lot. Like, you just start thinking of all the things, like, what if I can't have a baby? You know, what if I get pregnant and then I lose it? Or like, will I be okay? Can I enjoy sex again? Can I just get my normal back? Can I establish a new normal? And then you're just like wondering, is this even working? I know that I have to go. And there's so many days where I get up, I'm like, bro, I don't want to go. I want to cancel. But there's a $50 cancellation fee. And I'm like, bitch, I'm poor. I can't afford that. And I'm like, these people are giving their time to me. The least I can do is show up. And sometimes it's just hard for me to show up and be present in any aspect of my life. Like, recently we went to an event at my in-laws' house, and I literally was spaced out the entire event. And actually my in-laws both asked me a question, because I hadn't told them yet. Well, I'll tell you what I said. But basically, I had texted them right before Christmas, and I was like, there's something I need to share with you, but I was like, I'm not going to share right now because it's the holiday season, and like, I didn't want to ruin anyone's day. And so we had went over there, and like 10 15 minutes apart, both of my in-laws, my mother and my father-in-law, were like, hey, I thought you said you had something to tell us. And I'm like, this is supposed to be a festive occasion. I'm not really trying to bring that here. I don't want to bring down the mood. And I don't know why it just got to me. There's certain things that just get to me or trigger me or upset me. And they didn't do anything wrong. They were just genuinely asking a question. I said, let's talk about it another time. And I literally could feel my heart fucking pounding. And I was like, I'm about to have a panic attack. I was like, I got to get out of here. And of course, everyone starts walking through the door. So we go upstairs to my husband's old room. And I was just telling him like what was going through my mind. And I like cried, because I was like, I can't deal right now. And like the entire party, I was just like, I don't want to be here. But I was like, I'm trying to support him. I'm trying to be there for them. Like, you know, my in-laws were nice enough to open their home to me. Like, but I was like, no one knows how much I suffer. No one knows how much I go through. No one knows how hard it is for me. I have to literally push myself. I have to talk to myself like I'm like a baby or a child. Like, you can do it. Like, just very like soothing, almost like a kindergarten teacher or like a therapist. Like, you know, therapists obviously are there to soothe and to help us work through our trauma. I'm not trying to shit on therapists, but you know what I'm saying? Like maybe not a therapist, but maybe like a coach or something like that. You know what I mean? But it is so hard for me. And usually I told you guys, like when I'm getting ready to go somewhere and do something fun and I'm excited, then all hell breaks loose. And it's just like I always have some type of accident, whether I bleed on the floor, clot on the floor, clot in the toilet. And I look and I'm like, that came out of my fucking body. Like it looks like fucking watercolors. There's so much fucking blood. Like, oh my God. And then sometimes the clots will come back to back to back. Like I can literally feel my body like clench up, like seize up. Like it just drains the fucking life out of me. And when I first found out, I didn't even tell anybody. I just kept it to myself for a month. And I was like, why am I keeping quiet about this? And finally, I worked up the courage to tell my parents. And they were just like so supportive and like, let me know whatever you need. I'll pray for you. Do you need me to come to appointments? Like, they were like a 10 toes down. And I was like, I love that for me. And then finally, I think that there's like a sense of shame and there's like a little bit of stigma with it because you're like, what is wrong with me? What is wrong? Like, why can't I just be normal? Why did this happen to me? Actually, my doctor, he said to me, he was like, you're about a bad deck of cards. Like, and I was like, that's true. And he told me it wasn't my fault. And for so long, I felt like it was my fault. I was like, maybe if I had stepped up sooner, but I'm like, no. And I almost beat myself up for that because I was like, why didn't I act sooner? But I was like, I wasn't there yet. And what if I had started, but then wasn't consistent or wasn't fully committed to the process? I think this time around, I'm like, no, I have everything to lose. Like, my life is literally on the line. If I don't get this under control, it's going to control me. And right now, I feel like it's controlling me, but I'm like, no, I'm going to claim my body back. I'm going to reclaim what is mine because it is mine and it's not for this disease to take. But yeah, so I'm fucking terrified, you guys. Like in physical therapy, it just it pushes me. I'm like, that's an hour I'm paying someone to torture me, but my physical therapists are incredible. Like I love them down, okay? Like I love them down. They're so empathetic. They're so patient with me. If I say, hey, I'm not feeling it today, I'm having a flare up. Okay, let's repivot the exercises so we can try to work out some of the pain, the inflammation, but they won't push me like they normally would. Like today, my PT, she fucking pushed me. But if I say I'm like having a bad day or I'm in a mood, they honor that. Like sometimes I'll be having an attitude, not really towards them, but just like the situation, the gravity of the situation. They'd be like, okay, like they'll ask me like how I'm doing, like, you know, how my weekend was. But they really, if I say, oh, that was too painful or that was too much, okay, let's kind of